Welcome to South Georgia Career Center Phlebotomy 101 course. Table of Contents. Chapter 1, The Phlebotomist. Chapter 2, Blood Cells and Vessels. Chapter 3, Methods of Specimen Collection. Chapter 4, Specimen Collection and Transport. Chapter 5, Special Phlebotomy Procedures. First chapter, Chapter 1, The Phlebotomist. Contents in this chapter are: job duties and responsibilities, work environment, safety considerations, job duties and responsibilities. The primary duty for the phlebotomist is the collection of blood samples via venipuncture or micro techniques, but may also include the collection of tissue samples or other fluids. Blood samples may also be collected for blood donations, transfusions, and/or research. A type and the cross-match process take place for transfusions to determine if a patient will react after a transfusion, pre-analytic phase. The process of collecting specimens for further laboratory testing such as clinical pathology, which focuses on the study of diseases by laboratory testing of bodily fluids such as blood or urine, or anatomic pathology that focuses on testing specimens such as biopsy tissue, is also known. The neonatology department collects blood from newborns that are only a few hours to a few days old. If blood is collected for testing drug levels, the primary consultant for timing guidelines is the pharmacy or pharmacy department. Therapeutic phlebotomy, removal of a large amount of blood, is often used as treatment for hemochromatosis, porphyria cutanea tarda, and/or polycythemia. A phlebotomy technician must work accurately and well, even under pressure. They must be able to communicate well, have a basic knowledge of the healthcare system, and always treat patient-related information with discretion and confidentiality. The work of a phlebotomy technician requires daily interaction with medical staff as well as patients, ranging from infants to geriatrics. Having knowledge of patient psychology and being able to calm patients down is therefore important. It is also important to practice cultural sensitivity as well as learning other values, beliefs, and traditions, practices. Job tasks may include assembling equipment, needles, collection devices, etc. Keeping track of supplies. Following safety rules at all times. Verifying and recording patient information. Assisting patients before, during, and after the procedure. Disinfecting areas being punctured. Drawing blood and/or other specimens. Labeling and storing blood collection devices. Reporting possible hazards. The work duties of the phlebotomy technician can be categorized into 4 major groups: equipment, procedure, patient care, records and patient information. Equipment. Phlebotomists must ensure that all equipment and areas used are sterile or clean, disinfected and unused. Equipment includes needles, bandages, gauzes, tubes, other collection devices, as well as labels for tubes. Tracking supplies to ensure that proper amounts are always present, inventory and stock. Disposal of needles and other used supplies. Procedure. Correct puncture or incision of patient's skin. Collecting the correct amount of blood or other fluids. Correct labeling of collection tubes, devices. Completing and submitting documents needed to lab. Patient care. Reassuring patients, as some may have fear of needles. Being able to answer questions that patients may have. Verifying patient information to ensure accuracy of tests or procedures. Monitoring patient during procedure to prevent movement or fainting. Records and patient information. Patients' rights must be respected. Keeping patients' medical records confidential. Accurate documentation of collection ordered tests and test results. Providing accurate documentation to the laboratory to ensure the performance of tests ordered by a physician. Quality improvement methods. Quality improvement methods may include the use of data-based methods in order to reach improvement. Flowchart, used to break out components into diagrams in order to understand a process. Pareto chart. Bar charts are made that show the frequency of problems. Quality improvement for specimen collection usually involves the technique of the phlebotomist, the frequency of hematomas, and the recollection rates. Quality control records should include the following information: expiration dates, stability information, storage information, proper use, the precision of testing supplies or reagents, accuracy of testing supplies or reagents, work environment. Hospital. An institution that provides the medical and surgical treatment. Clinic. Institution or hospital department focusing on diagnosis and care of outpatients. Doctor's office. Suite, office where doctors receive and treat patients. Laboratory. Building or room where tests are performed to evaluate specimens in order to diagnose medical conditions. Blood bank. The institution where blood is collected from donors, and then stored and prepared for transfusion. Research firm. Institution equipped for scientific, medical research that may specialize in basic research or on specific areas. Pharmaceutical firm. An institution that develops and markets drugs for use as medications. Safety considerations. Phlebotomy technicians must be aware of the risks and dangers involved with specimen collection. Organizations such as the CDC have put out strict guidelines for healthcare professionals to follow to ensure their own safety, and therefore increase safety for patients and other workers. Universal precautions require that all used needles must be discarded intact. The purpose of infection control is to prevent the spreading of infection within a medical setting, such as a hospital, although certain bodily materials such as feces, urine, and blood can be a potential source of infection. Protective isolation setting. It is the phlebotomist who is a potential threat to the patient. Always wear masks, gloves, and coats or gowns when coming in contact with patients that are in protective isolation. If patients develop infections while in the hospital that was not present before hospitalization, the infection is classified as nosocomial. The chain of infection usually includes the source, a susceptible host, and poor isolation technique. Hygiene. Wash hands with soap and water for 20 seconds if they are visibly dirty. Good hand hygiene techniques reduce the number of outbreaks of infections. Hand washing is the single most important way to prevent the spread of infection. Equipment. Gloves, masks, goggles, gowns, or coats. Autoclaves, instruments for sterilizing under pressure. Minimum PPE for general patient triage. Face shield. Goggles or eye visors. Surgical mask or N95 respirator. Isolation gown, ALMI Level 1. Disposable gloves as indicated. For example, when the presence of skin lesions or contact with blood and body fluids. Recommended PPE for suspected or confirmed novel coronavirus cases. Face shield, goggles, cap. N95 respirator. Isolation gown, ALMI Level 3. Disposable gloves, emergency needle stick information. First to do. If exposed to blood due to a needle stick or other sharp objects, wash the needle stick and/or cut with soap and water. Flush mouth, eyes, and skin with water. Report the incident to a supervisor. Seek medical treatment.